All right, everybody, so a skin cancer diagnosis is scary. It can leave you with a million questions and feeling uncertain about the future. But thankfully, the physicians at the New Mexico Cancer Center and health specialists of New Mexico are able to help you tackle that diagnosis head on.
That's right. In today's New Mexico Cancer Center segment, we are taking a look at the different procedures and treatments that they have to offer. Take a look at this.
New Mexico Cancer Center and Health Specialist of New Mexico are the proud sponsor of Health and Wellness on New Mexico Living.
Hello, my name is Jeremiah Johnson. I'm a radiation oncologist at the New Mexico Cancer Center. I'm from New Mexico and proud to be back in the state to serve New Mexicans in terms of their cancer care.
I'm Chris Shukla. I'm a radiation oncologist at the New Mexico Cancer Center. So I would say the most common types of skin cancers we're treating is definitely going to be your basal cell carcinomas and squamous cell carcinomas. There are a few other types of skin cancers such as Merkel cell and melanoma. We treat these, but usually in conjunction with some other form of treatments. Generally speaking, for early stage skin cancers, you have two options for treating, and the two options from a cancer perspective are actually equivalent. The gold standard right now is technically considered to be the surgery, and that's because you're kind of able to pathologically confirm that you got all the way around the tumor and got it out and then sort of reapproximated the tissues. The alternative treatment of superficial radiation becomes a good option when patients have a skin cancer that's on a cosmetically sensitive area, or if it's a skin cancer that's actually recurred after they've already had the surgery, or if for some reason they're not a surgical candidate.
The advancements of radiation oncology here in the past several years includes a type of radiation therapy called superficial radiation therapy. What that means is that we've gotten better and better about putting the radiation precisely where we want it and keeping the radiation dose low to the surrounding areas. What that means, practically speaking, is that the side effects to the surrounding areas can be reduced.
The first thing you do before you actually get any of the treatments is a planning session. The planning session, we have you come in, we draw on your skin, we take a couple of measurements, and we take a scan of the region that we'll be treating to assess the thickness of your skin. And we only treat to that thickness. The planning session part takes about a half an hour, 45 for you as the patient. It then takes us a couple of days to actually plan, and then you start coming in for the treatments. The treatments themselves are done anywhere from as few as 5 treatments to as many as sometimes 20 to 30 treatments. Generally, they're done every day or every other day, and each time you come in for a treatment, it's pretty quick.
In addition, we have radiation techniques including imaging guidance radiation therapy, for which patients can undergo scans before their radiation treatments start. That can better allow us to delineate the extent and location of the tumor so it can be more precise in the focusing of treatment.
During the course of the treatments, as far as side effects, the vast majority of people don't really feel this treatment too much, particularly during the first half. It's really the second half of any course of treatment that the side effects begin to catch up, and they get a little bit worse towards the end and the first couple of weeks afterwards. So what those are is some slight skin irritation right around the region that we'll be treating. So the skin may become slightly red or look like a mild sunburn.
The steps we take for patients during and after radiation treatment include regularly following them with on-treatment visit checks. That's an opportunity for us to assess, see how patients' skin and side effects are doing, to also answer questions. In terms of radiation side effects, the mainstay of assisting with treatment side effects include skin moisturizers and skin creams during the radiation course. And then looking more long-term after patients complete their radiation treatment, it includes recommending good sun protection strategies, including SPF sunscreen, SPF 30 and above.
And that skin reaction gets a little bit worse. The first 2 weeks afterwards, sometimes the skin can slightly peel. We give you a couple of creams to be applying to keep everything as clean and as healthy as possible. And then by the time we see you back, about 4 to 6 weeks after the treatment's completed, the skin's totally healed up.
Yeah, really great to see that they have different ways of handling skin cancer so you can get the treatment that best suits you.
Yeah, for sure. To watch that story again, head over to krqe.com and click on the New Mexico Living tab.